Good afternoon. This is show and tell time in Milford, Pennsylvania. This is Dr. Marina Buckley from MilfordMD, Cosmetic Dermatology, Surgery and Laser Center. As you see, we're all geared up for treatment. And today I'm going to show you how we use our favorite device, or at least one of my favorite devices, that's called Thulium laser. We use it a lot for treatment of sun damage, those brown spots that form due to sun exposure. So this is a medium aggressive laser, and it produces significant improvement after each treatment. So we're treating hands today. So as you can see on the hands, we're having some sun damage here. It's hard to protect the hands. It's harder to remember about putting sunscreen on the hands. We usually protect the face, but forget about our hands. So this is what we're doing today. We're going to treat those sunspots. So we're going to start with the right hand and do treatment on the right hand. And here we go. So the treatment is quite comfortable on the hands. This patient elected not to use any numbing, but we can certainly use the numbing if we treat larger areas, or we treat the face. The skin is more sensitive there, so then we use the sunscreen, use the numbing gel there. And of course, we apply sunscreen after the treatment. Nancy, how is it doing?
Fine. I really feel almost nothing.
Excellent. Okay. So as you see, the skin gets a little bit pink with each subsequent pass. And we keep on treating. Now, what's going to happen after the treatment is the skin does get pink, a little swollen the day of the treatment, and it feels hot. So we do recommend using ice baths, frozen peas, frozen corn to apply. It's great to use air conditioning, just blowing on your hands on the way home, Nancy.
Okay.
And then tomorrow the pinkness might still persist, but the redness and swelling will go down, and then usually you will start noticing darkening of the pigment, kind of bronzing of the skin, and then the skin will start peeling, will become a little rough, and that lasts for about a week. Okay, and we're going to apply ice now. So how bad was it?
Perfect.
Excellent, excellent. And we will do the same thing on the left hand as well. Thank you for joining us today.